Hey, Dragon Slayers. So today's video is about the cholesterol lie, part 4. As many of Dr. Berry's patients have transitioned from high dose statin therapy to very low or no dose statin therapy, there has been no increase in the rate of heart attack in these patients. However, he clearly has noticed a decrease in their muscle aches and stiffness and an increase in their energy levels. Meanwhile, his colleagues were busy prescribing the highest dose statin therapy their patients could tolerate. Despite the published fact that most patients who have a heart attack have a cholesterol level of less than 200. His fellow doctors were busy making Lipitor the best selling drug in history without preventing heart attacks. Many doctors today, even though they are beginning to understand that the cholesterol theory of heart disease is flawed, are hesitant to stop their patients' statin medications due to fear of lawsuits and or medical board consequences. It is truly a shame when doctors are afraid to do the right thing for their patients. If you're on a statin, talk to your doctor about slowly decreasing the dosage. Also, please take a daily dose of coenzyme Q10, 200 milligrams, along with the statin. Taking coenzyme Q10 can reduce the muscle aches associated with taking a statin, and it's very good for your heart health as well. Dr. Berry wouldn't blame you if you decided to stop taking a statin altogether. You're better off not taking it at all. Statins do not protect you from a heart attack, and statins are probably hurting you. Dr. Berry predicts that one day history will look back on the cholesterol theory of heart disease and the statin era of medicine with shame and embarrassment. Medical schools will use this period as an example of how research can go wrong and how big pharma can influence medical practice for profit. Doctors let their practices and the care they give their patients be hijacked by big pharma based on flawed research as they are being bluffed and or stiff-armed by their medical societies and medical boards to comply or else. Shameful practices such as this are a large part of the reason that alternative and homeopathic medicines are making inroads and are starting to be accepted by patients as being effective. Dr. Berry can't blame patients for feeling this way and for trying other alternatives. If what your doctor is recommending is silly and perhaps dangerous, then you're justified in looking elsewhere for advice on preventing heart attacks. Doctors can try to blame the drug makers and the medical journals for this travesty of modern medicine, but doctors are still signing all of these prescriptions to this day. So I recommend that you do as Dr. Berry does. Dr. Berry never gives a thought to cholesterol content of any food he eats, ever. He eats as his ancestors would have eaten thousands of years ago and lets his body take care of the rest. Although his diet is cholesterol filled, his cholesterol levels are always within the normal range. So, some other resources that you guys can check out. The average doctor is far behind on his homework concerning the live cholesterol. So, you should do a little homework yourself. Read the following books to become an expert on cholesterol and what it means for your health. The first book is called The Great Cholesterol Myth by Johnny Bowden and Stephen Sinatra. This book was written by a nutritionist and a cardiologist who teamed up to tease out the truth this overlapping, complicated subject. The second book that he recommends is The Cholesterol Myths, Exposing the Fallacy That Saturated Fat and Cholesterol Cause Heart Disease by Yufi Ramanovsky. I'm probably mispronouncing that. So this book includes good information that will make it easy to understand why you shouldn't fear fat and cholesterol. So that's what I've got for you guys today. Don't forget to like and subscribe because it really helps the channel out. And remember, guys, that together, you and I will slay the dreaded diabetes dragon.